The coronavirus, creeping onto the world scene only a few short months ago, and then exploding into our day-to-day lives. Every day we hear about the impact of corona and COVID-19 on, well, almost everyone. But how is it affecting disabled individuals? Today on Blind Abilities, we explore just how blind and visually impaired individuals have experienced and adapted to corona and COVID-19. We have circumnavigated the world from Australia to Malaysia.
My name is Elise Lonsdale and I'm from Melbourne, Australia.
This is Chi Chow from Malaysia.
England.
Hi, my name's Steve.
Joe Fishwick.
Trinidad and Tobago.
Marlon Pariho.
And Canada.
Nick D'Ambrosio.
The United States.
Laurie Thompson. Brooklyn.
Brian Fischler.
Sherry Mollengraf.
Jeff Baser.
In this, the 12th episode in our series Around the World with COVID-19 from a Blindness Perspective. We go back across the pond. Our guest today is Joe Fishwick. Joe lives in Teignmouth, a small seaside town in Devin on the southwestern coast of England. Joe speaks of her experience with the coronavirus from the outset, when she had to transition from her office to her home, where she works as an eye clinic liaison officer for an eye clinic in a local hospital. She speaks of the influence the pandemic has had on her family, on her guide dog Bruno, and on her charitable organization VI Talk, of which she is the chair. Now please welcome our guest, Joe Fishwick.
Contain, delay, research, mitigate. Wash your hands with soap and hot water.
Just hours after the first Briton with coronavirus left this hospital, another patient checked in. Tonight, a woman who was infected in China has become the 9th case in the UK.
The total number of coronavirus cases going up to 590 from 456 yesterday. 2 more patients have died, so that brings the total who have sadly died to 10.
We have the latest data now from NHS England that the death toll in the UK has now been confirmed at 233.
The rapidly growing number total now stands at 759 people, 181 in the last 24 hours alone.
The numbers that they've just given us, an increase of 759 deaths, taking the total sadly now to 18,100 within the UK. Confirmed cases, an increase of 133,495 people testing positive for COVID-19.
Hi, my name's Joe Fishwick and I live in Devon, which is in the southwest of England. I'm a guide dog owner, totally blind. I'm married. I have an 18-year-old daughter.
Despite having coronavirus on the doorstep, work continues here in Devon on the Heritage Railway. Right next door to the railway is the school where a pupil tested positive for the virus a week ago. It's open for study again today, but the church in the village is staying closed.
Nationally, we've issued guidance to churches to start thinking about what might happen if they are in a situation like Churston Ferrers.
Devon is coping but in an insecure atmosphere. Most here expect it to get worse.
At the beginning of the pandemic, I was working in an eye clinic in a hospital in Exeter. It was a few days before lockdown was announced that we were told to kind of leave the eye clinic and begin working from home, or at least making preparations to work from home. And it was very quick. There was kind of no time to really think about it and pick up things that you needed other than essentials. So we went home and began the process of setting everything up to work from home.
We remain in the contain phase of the outbreak, but watching what is happening around the world, our scientists think containment is extremely unlikely to work on its own, and that is why we are making extensive preparations for a move to the delay phase.
And delay won't just slow the virus, but potentially hold up millions who could soon be asked to stay at home.
We are now very close to the time, probably within the next 10 to 14 days, when the modelling would imply we should move to a situation where we say everybody who has even minor respiratory tract infections or a fever should be self-isolating for 7 days afterwards.
So those with symptoms who don't need hospital treatment will have to stay indoors at home, where many won't be able to work.
I found that quite difficult because we've got a fairly small house and we're working in the living room of our house. So at the end of the working day, it's having to switch off from work and begin family life. Also, I'm quite lucky in that my husband is also my support worker, PA, whatever you want to call him. So when we're in the eye clinic, he reads and writes for me, does photocopying, scanning, various other bits and pieces, whatever I need really, and he also drives for me, which is great. So I've been very lucky that he's been able to be at home and still be my support worker. So I've still been able to do my job, more or less. It's not been exactly the same. I also have, as I said, a daughter who at the beginning of the pandemic was 17. She finished college because they were told to leave and come home, and they were working from home, which she found quite difficult, I think, not interacting with her peers. So the difficulty is staying separate when I'm working, because a lot of my work is confidential with patients. So she was working upstairs in her bedroom, and myself and my husband, Rob, were downstairs in the lounge. I found it quite difficult with my guide dog, Bruno. He's been quite poorly all through lockdown, and so he's been having blood tests and different things to try and get to the bottom of what's wrong with him. So I've not been able to go out with him every day. I certainly haven't been working him very much at all. I've tried to make sure when he's well enough that he gets a walk every day, but I've not gone out unaccompanied. I've always had my husband or daughter with me. I have been concerned about his work routine because guide dogs tend to thrive on routine. We are getting to the root of the problem with him, so he's on medication now, so I have actually worked him into town. Now I live in a seaside town which has its own challenges. And I was a bit concerned because obviously guide dogs aren't taught to social distance. But I worked him into town with my husband with me, and he was poor perfect. It was amazing. He'd not forgotten a thing. He was confident, finding all his crossing points and everything. So that made me feel better. I was, however, quite apprehensive about going out for the first time. All I've been doing is going out to take him for a walk every day, but it's been a lead walk, or we've driven to a country park, let him go free and walked around there, which is acres and acres of land where you really don't need to come into contact with anybody. I count myself as very lucky because my husband drives. My daughter is sighted as well. She doesn't drive yet, but I'm lucky that I've got them to go out with me to make sure Bruno is exercised. Shopping, we took the decision at the beginning of lockdown that because Rob can drive, that we wouldn't take a slot from online shopping. We would go to the shop. Rob's asthmatic, so he was driving us to the supermarket and my daughter and I were going in to do the shopping. Yeah, so that's how we've been doing it. And I'm lucky that they've been able to come out with me and exercise Bruno to make sure that he gets as much exercise as possible. It's not been as much as normal, but it's not been too bad. I've always gone out armed with hand sanitizer, wipes and things like that, and I'm quite fastidious.
A major incident declared after thousands of people defied advice to stay away. Illegal parking, 33 tonnes of waste, drunken fights and gridlock on the roads. Further down the coast in Brighton, marshals were on standby, ready to shut down the beach should similar crowds occur. Impatient for the next phase of lockdown easing, social distancing rules seem to be going out the window. Could this undo everything we've achieved in lockdown?
I was a bit apprehensive when lockdown eased. It was kind of like, you can go out and shops were opening and pubs were opening, and I was kind of like, I don't think I will. I think I'll just stay as I am. I think I'll just do what I've been doing all the time. But my daughter's 18th birthday was looming, and I knew that we would have to do something for that, and it wasn't celebrated in the way that we probably would have done, but it was lovely all the same. We did go to a local pub.
Pub life is back, but different. The old familiar is unfamiliar. Stickers leading to the bar, hand sanitizer on the wall, and you need to give your details for track and trace on entering.
I thought it'd be a lot busier than it is, but it's nice to kind of get back to normal.
Ultimately, this is an experiment. Nobody knows what this easing back to normality will bring, and a lot will depend on how we behave. And whilst it is essential for the economy, it is also a potential opportunity for the virus.
As a totally blind person, you can't look around you and see where people are. You walk into a place and you don't know where people are. You don't know if you're encroaching on somebody else or if they're doing the same to you until you actually feel them near you. That I found quite stressful. But it was a lovely day and it was quite quiet. It was quieter than I thought. I thought we would be inundated with tourists, if I'm honest, being a seaside town, and it wasn't as busy in the town as I'd expected it to be. So that was much less stressful than I'd thought. I have to say it was lovely to kind of sit outside a pub and friends pass by and just to have a chat, because everything's been done online, over the phone, over Zoom, over Microsoft Teams, and although that's been fantastic, it has been very, very different. So it's actually been nice. Although you can't give somebody a hug, that's quite hard, I think. I'm quite a tactile person with family and friends, but you have to do what's right. You have to wear those masks and you have to keep your distance, and I think that's quite hard. I did have an occasion where a friend came up and, just because it's the natural thing to do, came in for a hug, and I threw my hands in the air and went, "Whoa, back off." And they did. And for a second it was uncomfortable, but we laughed about it. But I think it's just getting used to what we're calling, I guess, the new normal. I'm also chair of VI Talk, a charity that supports blind and partially sighted people over here in the UK. And that's been different as well. Very different. At the beginning of lockdown, we took on some new volunteers, because normally we would do face-to-face meetups where people can get together, listen to talks or do arts and crafts, that kind of thing. We had to cancel one at the beginning of lockdown. Fortunately, we didn't lose an awful lot of money on that, but we knew that we wouldn't probably be able to have any events for the rest of 2020. We don't know what will happen in 21, but we'll take that as it comes. But we decided to get a license for Zoom and try and bring people together. So we took on new volunteers and we ran 3 Zoom chats a week, and they were really successful. We did some general chats and we've done some themed chats. So we've talked about things like travel, which has been really big, obviously, on the COVID-19 agenda, especially for disabled people. We talked about reading and books. We talked about fashion and skincare. We talked about sport and leisure and how we're doing that differently, because obviously you can't go out for a run, you can't go out and play football or cricket or go for a swim or anything like that, or go to a gym. So we shared tips and ideas on what we were doing to keep active, or if we weren't really, because some people aren't, they're not able to. So those have been really successful. We're now doing 2 chats one week and then 3 chats the next, and our volunteers have been amazing. They've really stepped up to the mark to help us out with that. Our groups, obviously, on social media have been really useful for people to ask all those questions. Sometimes it can get a bit heated because the whole mask thing, am I exempt? Do I want to wear a mask? Am I going to wear a mask? And that's been quite tricky to deal with, all the interactions on the Facebook groups and things. But I think we've managed it pretty well as a team. As always, it's always teamwork. So I don't know when I'm going to go back into the eye clinic, into the hospital. I guess we are classed as key workers because we've carried on working from home, supporting patients. Our job changed slightly, so as an eye clinic liaison officer, or what we call an ECLO for short, we started checking in on all our older patients. So anybody over the age of 69, we were phoning them and checking that they had access to food and supplies, medication, prescriptions, that they could access their finances, that they could keep up to date with current news about the pandemic, and that they could keep in touch with friends and family, and that they were safe. And that's been interesting, but it's been a privilege really to support people. It's been difficult because normally we do things face to face more often than not, so it's all been phone based, which is quite difficult because some of our patients are hearing impaired as well as visually impaired. But we've carried on. We've been able to do what we call SIT calls, which is SIT, staying in touch. And if a patient is vulnerable, living on their own, we've been able to phone them once a week to check in on them to make sure that they're okay and that they're able to access the food and prescriptions, etc. So that's been good to be able to do that. I'm still doing that at the moment. When I'm in clinic, I don't have a set space. So as a totally blind person, on one hand, I'm feeling good about going back in whenever that happens, but on the other hand, I'm feeling quite anxious about that because the whole wearing of masks all day, every day. the sanitising, will the area be cleaned regularly enough? Will that be my responsibility or the cleaning staff in the hospital? The rooms that I tend to be in have clinical equipment, which, you know, as a totally blind person, you touch things to orientate, you touch things to find your way. Of course, Bruno isn't going to be, you know, he's not been taught to social distance. So the whole thing going back in there is quite tricky and it's making me a little bit anxious. I'm not sure when we're going to go back in. I suspect it won't be until late August, early September, providing we don't get a second wave.
Cleaning, sterilising, preparing in pubs, hairdressers, B&Bs. The great lockdown is being eased further tomorrow. Today, the government urged people to continue to act responsibly this weekend.
The success of these businesses, the livelihoods of those who rely on them, and ultimately the economic health of the whole country is dependent on every single one of us acting responsibly.
I have met up with a couple of friends. That was quite a challenge for me. I kind of went and met a friend for coffee. We sat on the seafront at either end of a bench. And it was lovely. It was so lovely to be sort of with her in person and to have a chat. We've been catching up over the phone, but it was nice to be there in person, you know. I am the old mother hen. Less of the old, I think. But at the beginning, I was kind of contacting all my friends in various ways, Messenger, WhatsApp, text message, and just kind of saying, how are you? Are you okay? Are you able to access everything? And yeah, so I kind of got the name the old mother hen, I guess. But that's the way I work. I think we have to take care of each other. We have to look out for each other. So I just hope that, you know, we come out of this as well as we can, that at the end of this we're safe and we're well. I'm wishing everybody the best. Stay safe, do what we need to do, look after each other and do what we can to help each other.
Scientists in Southampton say their trial could be a game changer.
It's the 20th of July and the top story for you today is that the government has signed deals to secure 90 million doses of coronavirus vaccines which are being developed overseas.
There are now an astonishing 23 coronavirus vaccines in clinical trials around the world, including 2 in the UK developed by Oxford University and Imperial College London. Today, the government announced deals with 2 overseas vaccine producers. Bear in mind that 9 in 10 vaccines are unsuccessful, and you see the logic behind the decision to back several horses in the search for a winner.
We'd like to thank Joe Fishwick for coming on to Blind Abilities and sharing her perspectives on the coronavirus and COVID-19 from Teignmouth on the southwestern coast of England. Be sure to listen to more episodes in our series Around the World with COVID-19 from a Blindness Perspective. And from all of us here at Blind Abilities, through these challenging times, to you, your family, and friends, stay well, stay informed, and stay strong. Thank you so much for listening, and have a great day.
When we share
what we see through each other's eyes, we can then begin to bridge the gap between
the limited expectations and the realities
of blind abilities. The realities of blind abilities.
For more podcasts with a Blindness Perspective, check us out on the web at www.blindabilities.com, on Twitter at blindabilities. Download our app from the App Store, Blindabilities, that's 2 words, or send us an email at info@blindabilities.com. Thanks for listening.